Hundreds of South African doctors and nurses are increasingly leaving the country. This is according to data tracking the flow of South African doctors and nurses to Canada. Poor working conditions, irregular pay, and the looming implementation of the National Health Insurance are being cited as contributing factors. So what does this brain drain mean for the sector, especially with such a huge shortage? Let's ask Dr. Mzukwa, the chairperson of the South African Medical Association. Dr. Mzukwa, thank you very much for joining us here on the South African Morning. Always lovely to chat with you. So the doctors and nurses have always been leaving South Africa, right, for years. In fact, I have a friend whose mother left South Africa when I was still in primary school. It's always been a problem. Why should we, worry about the recent exodus?
Good morning to you, Masiko and Braden, your team and your viewers, and thanks for having me. This is very crucial for the country to note what is happening in terms of the immigration patterns. If you look at the survey that was done in 2022 around September, it shows that about 36% of healthcare workers are likely to leave the country, and those that are uncertain are sitting at around 23%. And those that are unlikely to go are sitting at around 1%. And you'll notice that a majority of those, more than 60%, are those that are younger than 45 years of age. And those people are going to Canada at around 22% of those are going to Canada, followed by 19% going to Australia. The UK as well, sitting at around 11%.